Welcome to the last webinar in our series, to the bonus session. This afternoon's webinar is going to focus on how you do STEM in infant toddler childcare, how you can help support teachers to be able to do this with children. So we're going to talk about a lot of practical things and different kinds of strategies. And I hope that throughout all of this, that you will also contribute by going in the chat and being able to contribute ideas that you have. So this last webinar is brought to you, as all of them have been earlier, by our STEMI Early Intervention team, which is me and Shoanne and Tana, and we're all here today and anxious to hear what kinds of things you might have to bring to this situation, what kind of successes you've had, and also what kinds of challenges. So how about if you can type into the chat, as you have in earlier webinars, if you can type into the chat where you're from, what your background is, your discipline, and we'll take a few minutes just to let you check in. So I see a number of people who I recognize the names that you have been present before, and some new people whose names I don't so much recognize, but maybe I didn't read the chat fast enough before. So lots of people from Pennsylvania. I love that. Lots of people from North Carolina. This is great. A lot of people. So this is wonderful, and good to see that so many of you have returned, and also good to see that we have a group of people that's pretty interdisciplinary, not just one discipline or another. So with this, today, we're going to just briefly run over these house cleaning items as we have before. The CEUs for the live session participants will be given like in the next week or so, next couple weeks. And since we're now finished with the series, and you're going to receive a request form about the CEUs, and you should fill that in when you get it. It'll be in a couple days. And during today's session, if you encounter any issues, please message Shoanne and she will be able to help you and see what it is that you can do. And then, as always, the webinar will be recorded and you will be able to get the recording probably within a week after this session is over. So today, what we're talking about is really how you can use teacher planned or spontaneous classroom activities and routines to be able to look at embedding children's IFSP goals, which throughout this session, I have pretty much talked about or as developmental skills, because typically what's on an IFSP has to do with children's development, social, emotional, or fine motor, gross motor, etc. And also how we can use these activities and routines as an example of what we can do to embed STEM. So this is important because everybody who's working in early intervention is not necessarily working just with a child at home. Some people never see children at home. They only see children in childcare. Some people see children partly at home and partly in childcare. But as soon as you're in childcare, it adds an extra dimension to this whole situation, which is complicated enough because now it's not just interacting with the parent, but now you also have to interact with the teacher. So that's what we're going to focus on today, is really interactions with teachers and how this can work and how you can try to get it to work when you're doing this. Okay, so
So
first,
Pip, sorry,
yeah,
interrupt you for a second before we
sure.
move forward. Just want to let you know your video is not on, so just want to make sure that people can see you.
Oh, okay.
Okay.
All right. Well, I keep getting these messages. When I get it again, I'll turn it on.
Yeah, I can do it now,
I can
right now,
turn it
really
on
quick.
actually
Yes.
right this second.
Okay, yes.
Okay.
All right, thank you.
I should not be sitting in front of this window, but whatever. Okay. So, when you're thinking about infant and toddler childcare settings, what comes to mind? And it would be really helpful if you can type into the chat some of the things that you think about when you're thinking about what characterizes or what your experiences have been working with infants and toddlers in an infant toddler childcare setting. So what kind of things come to mind? I'm going to give you a few minutes to type these into the chat.
So Pip, I just wanted to let you know there are a couple of response there. I don't know if you can see the chat, but I'm happy to read it out
Okay.
loud.
Yeah. I can, and that's many of these are really good. Thinking about inclusion, thinking about developmentally appropriate activities. That's always a good thing to think about. What other things do you think about when you're thinking about just the characteristics of childcare? Social interaction. That's great. These are such good answers. Probably you don't even need to sit through this webinar, because people already have such good ideas. Like play is a big characteristic of these kinds of situations with infants and toddlers in particular. So there are a lot of different things that people can be thinking about that characterize childcare settings. So some of the things that I was thinking about are things that have to do with the teacher and things that have to do with the early intervention provider and things that have to do with different people who are involved in this particular situation. So just to really think about it, I was thinking more of roles, and you certainly did describe a lot of things that happen in childcare. So in terms of roles, what kind of roles do people play? I think it's important always to just kind of stand back and sort of reflect on, kind of be explicit, I guess you would say, on what are people's various roles that they play in these situations. So obviously, with teachers, they provide caregiving. They're taking advantage of spontaneous learning opportunities with children during caregiving and routines. And then they orchestrate opportunities for learning for groups of children. And they do this in a variety of different ways, by capitalizing on child's interests, by providing materials, by providing kids with access to activities, allowing them or creating situations where they can interact with other children, where the teacher's able to begin to teach them how to get along with other children or how to interact with other children. And also, teachers use scaffolding and adult provided strategies to build on learning. So this is kind of what the teacher's role is in in a childcare, or really in almost any kind of group-based situation. The early interventionist role, if you think about your own role in terms of home-based early intervention, forgetting about the teacher for a minute, but your role is really to provide interventions for an infant or toddler so that they can acquire developmental skills or STEM skills, which mainly they're going to learn through access to these particular opportunities, through opportunity itself, and then by being able to do things again and again and again, by being able to practice them. And generally, I think in early intervention in a home situation, we're working one-on-one, or in a triad, really, with you and the family person, the parent, the dad, whoever it is, and the child. And generally you're working in the home, or you could be working in a community setting of one sort or another. And a primary responsibility that you have is to coach families about how to embed learning opportunities, whether it's for developmental activities, for STEM learning opportunities, into naturally occurring family routines and activities, so that you're addressing family priorities and concerns. So think about just for a minute, and then if you have some thoughts or ideas about this, please again type it into the chat. But how do these kinds of roles, how do they vary, or how do they change when you're in a childcare setting? So when your focus is not so much the parent and child dyad, but where your focus is the teacher, and not really a dyad, but the teacher against kind of a group of children or with a group of children. So how do you see some of these things as differing? In other words, what would you do differently in a childcare setting than you would do in a home setting? Well, I don't know if my chat isn't working. Oh, okay. All right. So somebody suggests that you would need to include all of the children in the activities and teach the teacher. So those would be two differences for sure. What are other differences that might be true in a childcare? In a home-based situation, for example, we're working with families and families' priorities, families' goals. Do you think when we go into a childcare program that we're working with the teacher's priorities and goals? That's great. Yes, you have to have them involved. And yes, you would want to know what's important to them for sure and what their priorities are. But as one person is mentioning here, you can't be quite as individualized maybe as when you're working with a child as opposed to maybe with a group of children. So you hope that there's some communication going on with the teacher, and you hope that that this will work. But obviously, it's a little different than when you're in the home, and it's maybe so different that you have to really think about it as a different model. While much is the same in terms of you're interacting with a parent or you're interacting with a teacher, a lot of it is not the same because the teacher is not the parent, because there's a group of children that are in the room, which could be true in a home situation too, but and often is, but it's just always just a little bit different. So so when we think about this, oh, I don't know what's with my computer today. Maybe it's what's with me, but I can't get these slides to turn. Okay, so when we think about this, we can think about that our interactions with the teacher may be different, but we also want to think about what is the role of environments? What role does the environment play in infant toddler learning? And I know many of you have experienced these kinds of things because you have to think about how is the classroom organized, what materials are available, what materials are accessible. Many classrooms, I'm sure many of you go into programs, even for infants and toddlers, where there's many materials, but they're not all where they're accessible to the children. Um, for a variety of different reasons. And then you also want to think about environmental characteristics. Some environments are very, very loud. Some environments are not so good with lighting. All the lighting might be fluorescent. Some environments aren't necessarily always well under temperature control. They may be too hot or too cold, or it might be hard to get these just environmental characteristics. So one of the things that we want to think about when we first start out is the fact that environments can play an important role. And those of you who've had a lot of experience in childcare settings and for example, with childcare curricula, know that the first step in any of these curriculum, whatever it is, curriculum that somebody might be using, is to look at the environment. What's happening in the environment? It's the first thing that teachers are taught in childcare classes, is how to arrange the environment, what to do to make the room conducive to learning, so that you physically organize things in such a way that children have access safely to materials, that you have a variety of materials that might be available, that you've done what you can do to control sound and light and temperature, and that the classroom is organized into different kinds of settings, I guess you would say, subsettings, in order to enhance children's learning. So babies are expected to engage with materials and people through exploration. We expect them to be able to take in information via their senses, to be able to see and hear and feel and move. And we expect them to be able to show what they are thinking and learning by movement or in various ways of communicating. So if you've taken some of these other webinars that you've done, you know that there are many children who maybe don't see so well, or can't hear so well, or are very sensitive to sensory things, or are unable to move around. So therefore, they don't get sensory experiences via movement. So, and these same children or different children may have a lot of challenges to show us what they're thinking and learning, because they maybe don't move that well, or maybe they don't communicate that well, or in ways that, or as adults, we may not be able to read their communication in order to understand it. So these are two things that I think are really critically important in what we do with children, particularly with STEM learning, but also with learning that relates to developmental stuff. We can only know what kids know and what they're thinking about if we can see it through movement or through various ways of communicating, because infants and toddlers do not, as we all know, talk to us with words. So we also think that children are expected to engage with adults. We expect that children will follow guidance that's provided by an adult. And I say guidance here, not so much teaching, because a lot of the interactions that teachers have with very young children are really facilitations. They're facilitating various things, but they expect that children will eventually be able to follow those facilitations, or will be able to get more complicated thinking or have more complicated experiences, because part of what that guidance is doing is providing scaffolding that's designed for kids to be able to move up to more complicated ways of doing things. So we expect all of that, but we also think that children are going to learn through discovery, and that they're also going to learn by themselves. Maybe they're doing something all by themselves and they discover some things, or maybe they're with another child and they discover some things when they're with another child. So these, I think, are things that engaging with materials and people are things that we think about that are really important. But we also expect kids to be able to follow classroom and program routines, even when they're tiny little babies, that teachers usually set up a routine in the classroom so that children understand what's coming next, so that it's not a free-for-all all the time, or we hope they do, right? So that kids know what's expected of them, and or that they begin to learn what is expected of them. So within this situation of being in a classroom and thinking about, oh, how do we get teachers to do what we would like them to do in interaction with children? We have to remember that that the overarching kind of thing is, what's the environment? What does the environment um, provide or give to this particular situation? What do we think about what we expect from childcare teachers? What's the role of childcare teachers? What's the role of early intervention people? And what's the role of infants and toddlers? So everybody has like kind of a little bit of a different thing. So we can look at this teacher who's up here on the top of this diagram, and her responsibilities are two groups of children. And we can think about the early intervention person who's on the bottom, and her responsibility is sort of to one child, but her responsibility or her interactions are also with the teacher. And whereas the teacher's primary responsibility is to the children, the early interventionist has kind of two responsibilities, one to the child and one to the teacher. And within all of this, what controls it, or what has some degree of like kind of boxing it in, I guess you would say, making boundaries, is whatever the daily schedule is and how that daily schedule is adhered to, so that children get a sense of routines. So those are all kinds of things that you know already. And so when you want to think about what you're doing and what you think you should be doing when you're interacting with teachers and trying to have the child have supports for developmental and STEM learning in the childcare setting, I think step one is for people to stand back and sort of understand what's your own philosophy, what are your own values, and what are your own beliefs. And I think it's important to know that, or to be able to at least reflect and think about it, because how you see a situation may not be how the teacher sees the situation, or how another person, any other person, sees the situation. So I often think that in my experience in working with early intervention people who are working in childcare or even classroom situations, one of the first things I think people do is they come into a classroom and they observe in a classroom, and the first question they ask themselves is, would I put my child in this program? And if the answer is yes, or if the answer is no, right away that begins to channel how an early intervention person is orienting themselves to the situation. So I know many of you are from Philadelphia, so you've had this experience as well. And other people who aren't from Philadelphia have probably had this too in your own communities. But some childcare programs are pretty chaotic. And when you look at them, you think, oh my goodness, I wouldn't even have anybody there. And I think this is a typical thing that we all do when we're looking at different kinds of settings or different kinds of situations, is we kind of mirror what it looks like to us. So if we think, oh, this is really chaotic and how can anyone do anything, or why doesn't this teacher turn the television off, or all of those different kinds of things? Why does she have it on in the first place? When we think about those kinds of things, immediately we're thinking negatively about that particular program, which probably means that we're negative, not overtly maybe, but kind of negatively positioning ourselves in terms of the childcare program. And I think I would say the same thing the other way. If you walk into a childcare program and you think, oh, this program is just fabulous. They have all this material, these materials, and they have this up-to-date equipment, and this is a brand new center, and it's it has its own yard and it has a big playground for kids that's just fabulous. And would I put my child there? And you're probably already saying, yes, yes, I would put my child in that kind of a setting. Then your orientation to that program is going to be different than your orientation to a program that you don't necessarily like that well. So that doesn't change anything because you have to work in the program you don't like so well, just like you have to work in the program that you love. But I think it's important to be able to really think about what about that program are things that are important to you when you're looking at childcare. What is something that is really important to you? What do you expect to see? What would you like to have there? And with that in mind, probably some of it has to do with what your cultural values are, what it would be related to what features you would think was important. And that kind of thing is just, these are not necessarily things that are going to change or things that you even want to change about yourself or anyone else for that matter. But they are things that I think are important to understand so that you can think about more explicitly or purposefully, how you're orienting yourself and what are some strategies that you might want to do. Another thing that I think is really important is what is your understanding of disability and how to best address child needs. So based on what you all put in the chat earlier, I can see, a lot of you put down inclusion was important. Put down it's good for children with disabilities to be with peers that are non-disabled, that kind of thing. But everybody doesn't necessarily believe that. Some people believe that children with disabilities are going to do best when they have a lot of services and when they have a lot of services that are provided that will help them overcome whatever their developmental disabilities are or whatever their child needs are. So it's not, again, anything to make a judgment about what is the right way or what is the wrong way, but just to begin to think about the fact that that your own behavior is going to be influenced by what some of your understandings are about and some of your values and beliefs are. Again, many people don't really want to work in a childcare setting. And they really would much rather be working with that child at home. It's certainly a whole lot less complicated to be working with that child at home as opposed to in the childcare setting. Working with children in childcare is very challenging. So with all of that, it's just, I think, a good idea to have a sense of what you think about yourself and your own perspective. So a second step, I think, is to understand the other side of the coin, which is to understand the program organization and what goes on in that program, what's their philosophy. They may have a philosophy that you disagree with, but it's their philosophy, or they may have a philosophy that you just love. So, and some programs are very philosophically based. For example, Montessori would be a good example. Reggio Emilia would be another good example. More corporate based kind of childcare that is childcare that it's provided by a corporation, may have their own curriculum, may have their own values, etc. So it's good to know what philosophy this program is operating under and what kind of thing they think is important for children. So what's important to the teachers, what happens during the day, what are some good times that happen in this classroom? So you want to be able to think about when you're there making a visit, what kind of things do you notice that are good times that occur? What are some things that are not such good times? You can always be in the wrong place at the right time, right? And then you can see like not such good things. Or you could be always in the right place at the right time and always be seeing good times. So you want to be able to think about that. You want to be able to think about how cultural values are reflected. And you also want to know, and I think this is really important, is what is the teacher's understanding of disability and how to best address child needs? Many teachers think that they're not good enough, that they don't know enough. They don't know anything about a child with autism. So why should that child with autism be in their room? Not because so much they don't want to do it or they do want to do it, but because of the fact that if that child had services from somebody who really knew what they were doing about autism, then maybe that child would do better. And the teacher who doesn't know about autism might feel like she's holding that or he's holding the child back because they're not as knowledgeable as other people might be. So these kinds of things about program organization and philosophy, I think you can learn from observing, although when you observe, some of them you can learn by observing, but all of them, you can observe what happens, but you don't always know. You can observe what the teacher does, but you don't always know if that's really reflecting her perspective about disability and how to address child needs. So those kinds of things you have to get through talking with the teacher or being able to interact with the teacher. And I think herein lies one of the biggest challenges in what happens in childcare. And this challenge, many of you could probably express that this was a challenge, and other people would know it because you can read in almost any book about childcare or inclusive childcare, or read about research studies that have been done. Probably the number one thing that comes up always is how do you get the teacher's attention? Because teachers do not have a lot of time, and they don't have time to sit down and have tea with you for, a half an hour or something, so that you would really be able to talk with them and be able to figure out what's important to them. So I wrote down some suggestions that I know about that either I've used or I know people who have used them. But how about if you put in the chat some of the ways that you've been successful or you feel like you've been successful in getting the teacher's attention? And by that, I mean getting the teacher that you can talk to the teacher, or you and the teacher can have a conversation. Or it might be better to say an exchange of information. So what kind of ideas do you all have about that? Okay, so here's a good suggestion. I think ask the teacher, not so much if it's a good time to talk for a few minutes, but ask the teacher when would be a good time to think about or to talk about these kinds of things. Because maybe right then is not a good time, but maybe another time would be okay. Always good to speak with a teacher about their concerns, always good. So sometimes what teachers don't have time to do is to talk at the moment that you're in the classroom. So there are a variety of ways that I think people have explored what would be some things that could be done in order to figure out what's important to the teacher, which is what her concerns are. I think that's absolutely critical. But a lot of ones that people have tried successfully, I think, are ones that don't have to do with talking at that moment, like right at that moment. So sometimes people take little video clips on their phone. I know somebody who does this all the time. And then she shares that video clip with the teacher. And then they talk about what they think, is working well, not working well, that kind of thing. Many teachers take video clips and send them to the people who come in their classroom, or show them to the people who come in their classroom so they can say, this is what I was meaning about his behavior, or this is what I'm meaning about I can't get this baby to be able to participate very well. So there are a lot of ways that I think if you're really creative, you can think about ways where video, short video, it doesn't even have to be that long. Short video could be something that could be exchanged, and that could be a way of discussing something when you're not in the room at that minute. Many studies have been done, particularly by a woman who has done a lot of work with children with behavior challenges or children with autism, named Erin Barton. And she's done a whole thing over many, many, many successive little iterations about how to use email and text as a follow-up. So, and in fact, in research studies that she's done, teachers have made more changes in their behavior when they've received emails, follow-up emails, when she hasn't even had a conversation with them at that time. So that's another way of thinking about doing it. And what this is just basically to say, you just send a little note, say, I was in your classroom today, and I was looking at what Johnny was doing and blah, blah, blah. And, here are some things, and here are maybe some suggestions, or if you'd like some suggestions, let me know, that kind of thing. Everybody knows notebook communication, I think, where you write in a notebook, like a logbook. When you're leaving, you write in the logbook, today I did this. This is what happened. And then the teacher can say, I tried this today and it was really successful. Many people use checklists. Other people, somebody just told me about this suggestion not too long ago, and I would have never thought about it myself, but she provided a teacher with a list of open-ended questions, like talk to me about what your biggest concerns are, etc. And then just ask the teacher to audio it on her phone and send her the audio tape. So that was good. Somebody can do that at any time. You don't have to have two people exactly in the same place. So I see that a lot of people, have tried some videos and using notebooks. I think notebooks are old school maybe, but notebooks are a really great way to be able to keep this kind of stuff going. So I think the first thing to think about is that our natural tendency is to want to sit down and talk to somebody, or want to have an interaction with somebody where we're having a discussion or a conversation. But that may not be the only way. We may have to be able to think outside the box a little bit in order to do that. We ran a coaching study a couple of years ago in Philadelphia, where the person who was the coach went in and coached and left and talked to the teacher during nap time. They would talk on the phone, and when she was long gone, she was no longer in the program. She was someplace else because she had a lot of people to coach. So that was something that worked well there. So as long as Raquel says, as long as you have a relationship with the teacher, they will, it will be important to them, and they will think about, how you viewed them and how you saw them, and how things worked. So that's step number one, get their attention. Okay, so step number two of that, related to that, is what you're going to do with the information that you get. So there are a lot of different things that you can think about, but basically I think that one thing that you can do is, when you know what the routines are for the day, you can try to match your visit with a routine that matches what you're trying to do. So for example, if the kids have like a time, let's say they're toddlers, and they have a time when they're doing like gross motor kinds of things, and you're wanting to help this child with gross motor skills, that might be a time that you try to schedule your visit. So you're going during that time of the classroom, as opposed to making your visit during snack time, when snack time really doesn't facilitate what it is that you want to do. One thing that I think is really critical is that you need to figure out ways that classroom staff understand and are aware of how important their interventions are in terms of helping kids acquire goals on the IFSP and in terms of improving learning opportunities. A lot of teachers don't really think that they can do these things. They think that it takes somebody who's really expert, who's really a professional. Like they don't think they can help the child learn to walk. They think it has to be a PT that helps the child learn to walk. So then when they provide learning opportunities for walking, for example, then at that point in time, they don't see that what they're doing is valued. So that kind of thing is really, really important. And also, I think that classroom staff don't always understand. We as intervention people don't always understand that opportunity and practice are really critical. And they're really critical for kids with disabilities, some kinds of disabilities, who may not get an opportunity to practice because they're limited by whatever physical disability, for example, they may have, or other kinds of things. So we need to always remember to have lots of practice and to think about how that's there, which means that the teacher has to help because we're only going to be in that classroom, like, let's say 1 hour once a week or something like that. And then the final thing is to be able to think about when you've observed these situations, what kinds of opportunities are there for adaptations? So the second challenge, I think, is addressing the environment. And this can be very challenging because these are not necessarily things that you have control over or that you think that you're going to get control over. It's really hard with visual and sound and things like that to be able to think about, what kinds of suggestions could you give teachers. But many teachers, I think, are happy to have suggestions if they're not provided in a really judgmental kind of way. The same thing is true. This would be true in a home as well. When in these under-resourced situations where there's very limited materials and very limited kinds of things for children to interact with, there may be very limited access to materials or very limited access to a whole host of activities. These are things that you maybe cannot directly impact on, but you can still be thinking about them and making, suggestions or thinking about resources that you could give a teacher. So a teacher might not want you to be talking to her about how noisy this classroom is, but if you give her resource materials about how to make the classroom less noisy, then she might appreciate that and might actually follow through. So these are, as I say, these are things that you can kind of indirectly maybe influence. And then the bottom one of safety is something that's A1 critical important in childcare. And that's one that if you observe, things that are not safe, then you definitely need to bring them to somebody else's attention. So addressing the environment can be challenging and can be something that is really, really, really hard to do. Sorry. Okay, so let's think about how we might do adaptations with children. And I often think that people kind of think that adaptations are one thing and interventions by an adult are another thing, and that they're dichotomous, that, it's either an adaptation or it's an adult assisted kind of situation. But in most instances, or in many instances, what the adaptation does is make it decreases the complexity of the activity, and therefore it makes it easier for somebody to provide adult assistance. So you can see this little kiddo here who has a spoon and has a handle that is holding the spoon and that he can wrap his hand around. And so that means that decreases the complexity of the activity because he's not going to be dropping the spoon, or the spoon's not going to fall out of his hand, or all of those kinds of things. And the attention can go to how he puts the spoon in his mouth. And this would be a good example of also talking about where you can embed STEM, because this is an activity where, you know, it's basically a means to an end. The spoon is a means to an end. And if we were looking at this from a Piagetian perspective, something that is attached is easier than something that's not attached. So from a cognitive perspective, the task is decreased in complexity because of this adaptation. But it also makes it much easier for the adult to provide the adult assistance, because the adult doesn't have to worry about, is the spoon in the kid's hand? Is the child going to keep holding on to the spoon, etc.? So adaptations reduce the number of needed adults. And in many childcare situations, in many classroom situations, early childhood education altogether, the first thing that a teacher thinks about is, I need more help. Give me more help. So the first thing they think about when they have a child, let's say, for example, this little boy who can't feed himself, the first thing they think about is, I don't have enough help for somebody to feed this child. Or they think, I need another person in this room so that this child can be fed. So adaptations reduce the number of needed adults if we think about what we're doing to make it possible for a child to be able to participate more independently, and how we can use adaptations to increase participation and learning. So with all that, I want to just very briefly show you, this is obviously not a baby, but I want to briefly show you this block activity. This would be a good example of a STEMmy activity with older children. And I want you just to look quickly and just think about what are all the different adaptations that have occurred. Okay, so put your ideas, put what you see in the chat. And I think that you can see something that often is not necessarily done, but the other children are doing this activity in standing, because this little girl with this motor and coordination situation, because she's in standing, and then in order for it to be a group activity, everybody's in standing. So that's pretty easy. But what other things do you see here that have occurred that are adaptations? So that's good. You know, that the table is at a height level for all the children. What do you think about the materials? You might not be able to see it so well in this video, but the materials are magnet blocks. So kids can put them together in all kinds of configurations. For the little girl with a motor coordination problem, they're also of a size that she can grasp. And good comment that they use the sensory table, the water table, so that the materials would stay together for longer. That's definitely true. But the older children and the children that have better motor coordination skills are able to do a lot of things with these blocks. And the little girl who doesn't have such wonderful motor coordination yet is able to at least grasp the blocks and be able to participate with other children in learning about what's going on with the blocks. So this is the kind of thing that we want to have optimally. And I'm always really interested in this, because you can see that the teacher is right there, but she's really not doing anything. She's not doing anything to help this little girl, which we don't want her to do anything to help this little girl, but she isn't doing anything to help her. She's not really directing the other kids at all. So that's an important thing to be able to see here in terms in terms of what's going on. Okay, many of you have probably seen this before. This is kind of what we would talk about in terms of where adaptations fit and how we think about them in terms of tiers. The first set of adaptations are things that are really what would be part of universal design. Tier 2 would be things that are definitely adaptations. Tier 3 would be things that are more complicated. So even with those, when we have adaptations or we have what we would think about as environmental interventions, then children can be more independent. So these kids are able to learn a lot about movement and force and motion and things like that, about moving their arms, moving their legs, all by themselves. No adult is around, but the environment has been orchestrated so that they're able to do this through spontaneous interaction. Here we see another kind of activity where children learn, which is through adult facilitated kinds of activities. The teacher here is facilitating these kids, playing with sand and different containers in their room. And then here we see something that happens a lot in infant rooms, which is that the teacher has set up an activity where children can do spontaneous learning. And she's done this by providing children with opportunities to interact with different kinds of materials, which is a really critical thing that infant toddler teachers often do. Is just, they're not doing a teaching activity particularly, but they're providing children with opportunities that they can explore the environment. So many of you I know are going to be familiar with Kara, and I just wanted to put this in that if you want to get a lot of ideas or learn a lot of different things about adaptations, you can use Kara's kit. Kara has a whole series of adaptations that run from the environment, doing what you can do for equipment, for adapting the room, all of those kinds of things, all the way down to the most intrusive kind of intervention, which is to provide adult assistance. So adult assistance is not the same thing always as adult instruction, but we want to do whatever we can so that the child needs an adult for the least amount of time possible, or to the same extent that other children of that age range or in that situation need an adult. So this has been modified into our adaptation sheet, and we thought we should show you the adaptation sheet since everybody's talked about it and since you've seen it in your resources. This is the STEMI version of adaptations, which just condenses Kara a little bit into thinking about what do you do for the environment, what do you do for materials, and what do you do for instruction. So many people have found this to be really helpful. There's a lot of different pictures, a lot of different suggestions, just as there is in Kara, as there are in Kara, a lot of different suggestions. So the thing about adaptations is who finds them, who creates them, who does this, who does that. So I always suggest to people, early intervention people, that they create an adaptation bag, and it does not need to be this suitcase necessarily, but something that they have with them that are the kinds of things that you need to make adaptations, or to sometimes also referred to as low tech, but to be able to make adaptations that will work for children when you have them. When you go in there and you say, oh, this kid could really be helped if this child had clips on the edge of this book, they would be able to turn the pages by themselves. So you want to have those kinds of common things that are related to the children that you work with, so that it's not like, oh, now they have to wait 2 weeks till you get it. Like, you can do it right on the spot. So challenge 4, I think, is working with children to embed or teachers to embed opportunities. These are the same things that Shoen shared with you last week in relationship to parents. So we need to think about active listening. We can coach, we can share information and resources, all of these are different ways that we can help teachers, provide support to teachers to be able to interact effectively with kids that are in their classroom. And one of those strategies is coaching. Coaching is a word that's kind of, I think, taken on its own meaning more or less. But in a typical kind of a coaching approach, we would expect that there would be a goal that the teacher and the early intervention person would have kind of a goal of what they would like to see happen. That you would use as the early intervention person. You might use strategies like demonstration or modeling. The teacher might do something and you would provide feedback. You might have joint problem solving, etc. So these strategies are available in this monograph, actually, in terms of what people typically use and how they are responded to. So just like many of you probably already know, in this particular study, coaches identified that the most often challenges were providers who were reluctant to participate, providers who often were working under a lot of stress. That might be true of the early intervention people also, and teachers who did not have enough time for coaching. So these are real challenges, and maybe they're, instead of trying to get people to respond to coaching, sometimes maybe what we need to do is to rethink it and provide them support and help in other ways, like maybe through handouts or maybe through showing them a video. Many teachers love seeing videos of something that works really well. Some of them do it actually on their own on the phone because you can do so much with Google. But at any rate, these are just like trying to think outside of the box. So some of these things are things like empowering teachers, sharing information and resources, saying to them, oh, go watch this video, it'll show you how to do it. Maybe sitting down and maybe just jointly problem solving, asking teachers, so what's the problem? Can you find the solution? Which is an integral part of many things, including Kara. Kara's whole thing is, what's the problem? And here's the solution. So you can figure out all these different sorts of things. You can observe, you can help teachers reflect, you can reflect, you can provide feedback to teachers. Feedback, I think, is really critical. And again, Shoen showed you some of these things last week to use in relationship to parents, but you can also use them in relationship to teachers. So thinking about, what's important. So the last two challenges, I think, are challenges for us, one of which is to try another way. So this is a little scenario where Miss Emily has 6 infants in her infant room and one other staff person, sorry. And she has this baby who's unable to move much and is not yet able to sit. So this child's physical therapist says it's important for her to practice so that she learns to sit without support and can begin crawling and using her arms for play. So she suggests that Miss Emily sit on the floor with her legs spread apart and have Rashawn sit between them during storybook reading or when playing with toys. So this is not an unreasonable suggestion. This would be a reasonable suggestion in many, many situations. But Miss Emily is 70 years old and she cannot get up off the floor without assistance or support. So she just basically chooses not to do this. So we need to always have, as many of you have said already, enough rapport with the teacher that you can figure out what's going on here. And you can just say, oh, okay, this is a good idea. This is a good suggestion, but it's not a good suggestion in this particular situation. So I'm going to try another way. And a lot of times we have to try another way multiple times before we come up with a way that really fits in a particular situation, a particular environment. So the last challenge, I think, is don't take it personally. And this is very, very hard for people because, we all sort of take things personally. But whatever, even if we take it personally, what's even more important is don't act on that. Don't act on your interpretation of the situation. If you act on Miss Emily and you say, oh, okay, so she's not going to do this, and you stop there, you're going to feel, like you didn't do a good job, like what 100 other things that Miss Emily's uncooperative, whatever. I mean, you could come up with 100 different things, but what you don't want to do is to act on that interpretation. You don't want to act because you're feeling badly. Instead, you want to think about and reflect so that you can take action separately from how you feel. So a last little scenario is that another teacher tried to do what the OT told her to do with Julia, which was to provide her with lots of sensory experiences, which the teacher did, but it only made Julia cry all the time, so she stopped. But she mentioned this to the OT, and the OT said, let me model for you so that you can see that she does not cry when I'm doing something sensory with her. And so Miss LaShonda felt as if the OT was talking down to her and saw her as stupid. So from then on, she just smiled and yesed any suggestion, but she did not act on any of them. Now, this is sort of a way out of the box kind of situation. I mean, I'm going to hopefully pray that none of you would be a person who would say this to a teacher. But on the other hand, teachers often do feel this way. They feel like, oh, they're not smart enough or whatever. And so you need to always kind of try to delve down and think about the fact that you're trying to get a relationship, no matter how challenging that is. And as we would say in Philadelphia for sure, it's not your job to be the boss. My grandmother used to say to me all the time. What makes you think you're the boss of this? So it's important to remember that you're not the boss. You're not trying to be the teacher's friend necessarily, but what you're trying to do is to support the child by doing as much as you can to promote opportunities for them to learn developmental, IFSP, developmental kind of skills and STEM skills. And I think it's important also to remember that it's not your job to do what the teacher says, even when it's the teacher's classroom. So I hear a lot of people tell me, I have to take the child out of the room because the teacher won't let me work with the child in the room. Or the teacher says I can only do this and not that. And so just because the teacher says it doesn't mean that you can't negotiate a better position or a better situation. A lot of times I think people so-called blame it on the teacher because that's what they wanted to do anyway. I mean, they wanted to be outside the room. Or they wanted to be in the back of the room with this child so that they could work with them one-on-one because they think that's what's really important. But it might not be what's in the best interest always of the child. So we're always, when we're in a childcare room or classroom, we're there to support the teacher and the child to the maximum extent possible, and for us to do the best job that we know how to do. And if we keep that in the front of our minds, then we will be okay at thinking about what it is that we can try again. We might have the energy to try something 10 times, try 10 different ways in order to be successful. So I hope you're taking home. I know we're over time. I can never quite get that right. But I hope that in the chat or in your evaluation form that you will let us know what further questions you have or what messages you're taking home today. I hope some of this has been useful to you and will at least make you think about what are the good things and the positive things. Many of you had such positive and such appropriate and good characteristics and comments at the beginning that maybe all of this is just old hat to you. But whatever it is, I hope it'll give you the motivation and the opportunity to think more about what we're trying to do when we're working with children with disabilities in childcare situations. Thank you for attending.